Hotter summers, worsening droughts, more frequent storms and heavier rainfall, more appearances of that infamous polar vortex we seem to see every winter, rampant wildfires, rising tides, more ticks and more mosquitoes, worsened air quality. These are all the symptoms of the climate crisis. Climate change is real. It is happening now, and it has previously been deemed to be one of the biggest threats to public health of the 21st century. As the climate around us changes, we will see more children with asthma, worsened maternal and child health, increased incidence of acute and chronic health conditions that impact the cardiovascular, renal, respiratory, reproductive, and gastrointestinal systems. We'll see worsened mental health outcomes, conflict, malnutrition, forced migration and diarrheal diseases, longer allergy and tick seasons, and most unfortunately, we will likely see more death. The climate crisis is a health crisis. Those who will be most harmed by the climate crisis are those whose voices have historically and systemically gone both unspoken and unheard. It will be children, the elderly, low-income communities, people of color, those with pre-existing health conditions or disabilities that will be hurt first and worst by climate change. The medical community plays a vital role in our response to the climate crisis, though. I see the role of medical professionals and healthcare providers taking three different potential paths as we address climate change. The first is through enhanced recognition of climate-related health threats in patients who are seeking care in order to improve patient treatment, diagnostics, and ultimately prevention. So picture this. A 35-year-old male patient presents in an emergency department overnight in late May. He's a construction worker. He just started a new job with a new company a few days ago, and those first few days of work happened to align with the region's first warm days of the season. He's found himself extremely tired, but he's unable to sleep. He's had a headache and cramping on and off, and he's found himself short of breath, even just trying to do basic tasks. Earlier that day, while he was climbing a ladder, he found himself extremely dizzy, worried he was going to fall. So later that night, he shows up in the emergency department, hoping the doctor can help him, treat him, and he can be back at work in the morning. Having just started this job a few days ago, he doesn't yet have sick leave, so he can't miss work. And worse yet, he cannot afford to lose this job. Those working outside, like construction workers, but also landscapers, delivery and postal workers, waste and sanitation drivers, farmers and farm workers, are all having to face working in a hotter and hotter climate. These individuals also disproportionately make up cases of workplace heat-related injuries, illnesses, and fatalities. In one study, compared to all other industries, construction workers were found to have 13 times the risk of heat-related deaths while at work. Those working in agriculture, forestry, fishing, and hunting were found to have 35 times that same risk. From locally to globally and across all at-risk industries, it is immigrants, migrant workers, low-wage workers, workers with limited English proficiency that lack the agency, ability, or job security to speak out against unsafe working conditions. Climate change is exacerbating this to a whole new suite of hazards workers may face. These workers may fear retaliation from their employer, not able to miss work if they're not feeling well, or even something like taking a break to cool down or get a drink of water. This patient was experiencing the symptoms of heat stress. Being new to his job, he lacked acclimatization or the tolerance to work safely in warm conditions. He needs the assistance of those emergency department providers to diagnose him correctly and offer him a treatment to stop the thermal decompensation that's happening in his body. perhaps going a step further, even providing medical recommendations to his employer so that he can safely return to work and not lose his job. And as a scientist who has spent the last decade examining the health impacts of extreme heat, we also need these providers to indicate these climate-related health impacts on medical records. This will help us address the vast underreporting of these symptoms that occur, which in part hinders our ability to demonstrate these climate and health connections. Clinicians must recognize an increasing number of things while providing patient care. But by integrating climate-related health threats and susceptibilities, we can improve patient diagnostics and treatment and avoid worsened health outcomes in these patients. The second way I see medical professionals as helping with the climate crisis is by serving as trusted messengers for both improved individual and collective action. Medical providers are routinely identified as one of the most trusted messengers in our society. Climate conversations can be difficult. They can sometimes even be controversial. But framing these conversations around somebody's health and actions they can take to protect their health make these messages more salient and actionable, and clinicians are uniquely positioned to have those conversations. For example, a healthcare provider could communicate with a respiratory patient on keeping their windows closed and using an air filtration system to protect them from having an asthma attack during the peak of wildfire season. They might be able to communicate with an expectant mother on how to keep her skin covered and use pregnancy-safe mosquito repellents to protect her unborn child from a mosquito-borne disease. They may even be able to communicate with a patient who has an arrhythmia about avoiding strenuous activity during the hottest parts of the day and how to properly and effectively stay hydrated so that that patient can avoid a cardiac event during a heat wave. These examples offer practical and effective conversations clinicians can have with patients to protect people from climate hazards. Providers are also uniquely positioned, though, to discuss these cascading and compound health impacts with those in positions of influence, like the media, as well as people in positions of decision-making authority, such as policymakers. Healthcare workers can make the case for how the climate crisis is presenting in a myriad of health impacts in their local emergency department, in health clinics, and in hospital beds. This conveys tangible inspiration for collective action. These acts of advocacy by healthcare professionals can shed light on otherwise unspoken conversations. And the third and final way I see healthcare professionals as helping mitigate the worst of the climate crisis is by reducing the climate footprint of the healthcare sector as a whole, so that it no longer is a major contributor to the health harms that are being caused by climate change. According to Healthcare Without Harm, if the healthcare sector were a country, it would be the 5th largest emitter of climate-emitting greenhouse gas emissions on the planet. In the United States, the healthcare sector is responsible for 8.5% of our nation's greenhouse gases. And this figure has actually grown by 6% in the time period from 2010 to 2018. When we look globally, the United States contributes 1/4 of all of the world's healthcare-related greenhouse gas emissions. These emissions come from things like on-site sources, such as boilers or gases that are used in medical procedures, from the energy and electricity needed to keep the lights on, but also from many indirect sources that accompany the products, goods, services, devices, and supplies that are needed within this sector. By continuing down a path of releasing more and more greenhouse gases, the healthcare system continues to contribute to climate damages. From a system that is based upon the principle of doing no harm, continued contributions to the climate crisis will perpetuate a system such that unspoken and also unheard voices continue to be disproportionately impacted by climate change and its resulting damages locally, nationally, and globally. The good news is, though, is that we have ways to improve this. We have many solutions at our disposal to mitigate climate change and also adapt to the damages that have already been set into motion. We can do things like improving energy efficiency, transitioning to cleaner sources of energy, disinvesting in fossil fuels, and reducing unnecessary travel. We can minimize waste that's produced and accompanies medical supplies, devices, food, and services. And thinking a bit bigger, healthcare systems are often large economic drivers and often large-scale employers of their community. They're positioned to be able to encourage local investments in things like public transportation, improved walkability of their communities, investments in carbon sinks like more trees and more parks, and prioritization of climate-resilient infrastructure. All of these efforts would immediately make our air cleaner, our neighborhoods more resilient, would better promote the health of our friends, families, and neighbors. And that sounds like a win-win to me. So in order to confront climate change in a way that protects public health, we need all hands on deck. Everyone has a role to play. But to recap what I've shared today about the role of the medical community, I see 3 different potential pathways to help in our attempts to mitigate and adapt to climate change. That first, recognizing that climate change impacts health in many different ways and integrating that information into patient care, treatment, and diagnostics to ultimately help prevent these health harms. The second is by inspiring and motivating both individual and collective action. This can be done by serving as trusted messengers of the health impacts of climate change and action needed to address it to patients, other providers, but also the media and policymakers. And lastly, taking steps to reduce the greenhouse gas emissions and climate footprint of the healthcare sector so that it is no longer a major contributor to these health harms that occur in result of climate change. All of these steps will prioritize public health. They'll promote better patient care, and they will also make the healthcare system as a whole more resilient to climate change. So yes, climate change has been deemed the biggest threat to public health of this century. But we're also being given an unmatched and unparalleled opportunity to create a better, healthier, and more equitable world. We just need your help to do so. Thank you.